Welcome to the City of Issaquah Senior Center Learning Lab Series. We're so glad you joined us today for this learning experience. For the month of May, our goal is to empower you with knowledge that'll help you navigate these challenging times. This is how it works. Our speaker will talk about her topic, then we'll have a Q&A, and lastly, we'll open it up for conversation about this topic or anything else you'd like to discuss. Today, I'm pleased to introduce Megan King on the topic of strategies to stay safe and prevent poisoning during COVID-19. Megan King is a public health educator at the Washington Poison Center. So go ahead and take it away, Megan. Thank you.
All right, thank you for having me. And for any of you who can actually see me talking right now, I apologize for my background. We have construction going on right outside my window, so this is the quietest place to be. So apologies for all of the clothes that you're looking at right now. So thank you again for having me here today. I'm really excited to talk to you all about this. It has really been such a challenging time for everyone, so I appreciate groups like this that are bringing folks together and trying to get the word out on really important topics. So since it's such a small group today, I welcome you to just ask me any questions you might have throughout. I'm going to cover a lot of different topics, so please feel free to stop me at any point if you need clarification on things. So as Catherine said, I am a public health educator with the Washington Poison Center. And I'm trying to figure out why my slides aren't advancing. There we go. So here we go. Apologies for that. So the Washington Poison Center, I'll give you a brief overview today of who we are and what we do, and then we're going to dive into an issue that is really important right now for us at the Poison Center, and that is poisoning during this pandemic. So I'll cover what I mean by the word poison, and then we'll dive into talking about cleaners, medications, hand sanitizers, risks as grandparents during this time, and then go through some prevention strategies that you all can implement to make sure that everyone stays healthy and safe. And we will end today by talking about what to expect when you call us at the Poison Center. All right, we'll start with the Poison Center. So we are a nonprofit organization that serves the entire state of Washington, and we have been in existence in some form of capacity here for over 60 years. We provide a lot of services across the state, but our two primary services are public health education, which is my job and what I'm doing here today, and then we also have our Poison Center telephone helpline, which is probably what folks are most familiar with, and that is this phone number. It is a national toll-free telephone helpline that you can call 24/7 every day of the year, and it is completely free. So you'll call it and you talk to one of our staff members if you are ever exposed to something poisonous or toxic. And they will treat you or provide information for you in a completely confidential manner. And if English is not your primary language, they can do so in over 260 languages. I have just a little bit of our data from last year, just so that I can share with you the volume of calls that we handle. So last year, our telephone helpline, we handled over 125,000 calls regarding more than 66,000 cases. So you'll see there's a difference in numbers there because some cases involve follow-up calls or multiple calls. And these calls come from all over the place. A lot of them come from home or from schools or the workplace, but we also get calls from medics or EMTs that are transporting people to the emergency department. And then we get calls from healthcare providers and emergency departments as well when they need help with more complex toxicology cases. Unsurprisingly, about half of our calls are about kids younger than 6. And a lot of different reasons why, but a big one is little kids love to explore the world with their mouths. So they frequently get into things that they should not. And so it's very unsurprising that we receive a lot of calls about little kiddos. But about 50% or so of our calls are older people, so teens, adults, and older adults. And those calls actually tend to be a lot more serious than the calls that we get in little kids. All right, so that was my little spiel on the Poison Center. So we'll move on now to what I mean by poisons. What would you even call us about? We take a very, very broad definition of a poison. For us, anything is a poison. Any product or any substance can be a poison. It can be harmful if it is used the wrong way, by the wrong person, or in the wrong amount. So obviously that applies to what you would traditionally think of as a poison. So, chemicals, bleach, really toxic substances, but it also applies to pretty much everything around us. So any sort of household product, I have a glue bottle there, that's a big one, craft supplies, cosmetics, things like that. Flowers, plants, berries, fumes, vapors, insect bites and stings, snake bites, medications, drugs. There are so many different things that are considered poisons, again, if they're used the wrong way by the wrong person or in the wrong amount. So when folks call us, we broadly bucket their poison exposure into all of these different categories. So you all are an older adult group as a senior center. So typically when I provide education to older adults, I usually just focus on these orange boxes, because this is what we hear about mostly with older adults. And that's medication errors, accidents with non-pharmaceutical substances, and then adverse reactions with drugs. But during this pandemic, really those orange categories have just kind of been thrown out the window. Now really anything can happen, and we are concerned about all of these different call categories. And why is that? The biggest reason, we are at home. We're at home all the time now. And so because of that, we might have some new daily routines. So we have difficulty remembering to take medications or something like that. We are probably having a lot more cleaning products, medications, all of these different substances at home so that we don't have to go out as often. We're using these products more, or we have increased access to them because we're home all the time. We might be feeling stressed or anxious, and that decreases focus. There's so much misinformation out there, so many rumors circulating about ways to prevent or treat the virus. And all of those can lead to accidental or intentional poisoning. And we are actually at the Poison Center seeing an increase in poison calls. So we have specifically seen spikes in substances that are common during this pandemic for preventing the virus, such as cleaning products and hand sanitizers. And our trends here in Washington are paralleling trends throughout the United States. We're not unique in this. Pretty much everywhere we're seeing more people having poison exposures to these substances. Okay, so now we're going to just go through some of the substances of concern right now, starting with household chemicals. So this is a very broad category. It includes cleaners and disinfectants, detergents, pesticides, fertilizers. There are so many different things that are as a household chemical. And really, this category has always been a top substance that we receive calls about. But during this pandemic, a lot more people are becoming exposed to these chemicals. They're having a poison exposure. So we are seeing this increase because there are more products at home, they're using them more often, they might be distracted. And then there's also just fear of this virus too, which may be leading people to use a product incorrectly or not as it's intended to be used. But to prevent poisoning from household chemicals, there are some really easy strategies that you can use. First is to just be safe when you are using them by wearing gloves and opening windows and doors to make sure that there's enough ventilation so you're not inhaling some of those fumes which could make you sick. Also, to read and follow all directions and safety warnings. So we hear about this a lot where someone may not realize that the product that they have is concentrated and it needs to be diluted before it's used. And so when they use it, they end up using a much, much more powerful product than they're supposed to be. Or we have folks that intentionally do this as well, especially during this pandemic. But it's important to know that more concentrated does not mean it's better or more effective. If anything, it could put you at greater risk of getting sick when using it. We also encourage folks to only use products as they are intended. So if that product is supposed to be just for cleaning surfaces like counters and stuff like that, we really discourage people from trying to clean something like their masks with it. Another big point is to not mix cleaning products. And a lot of folks don't realize that mixing certain products can result in hazardous gases that can make people very sick. So bleach is one of the biggest culprits with this. So bleach is in a ton of different products. It's not always just straight bleach. It might be in disinfecting products or other cleaners. And when those products or bleach just by itself is mixed with vinegar, ammonia, or rubbing alcohol, you can get some very toxic gases that can make you very, very sick. So we encourage folks to just never mix their products and to also be very careful when you're cleaning back to back with different products. If you are ever unsure about what is safe, you can always call us at the Poison Center. You don't have to have a poison exposure to talk to us and to get information. If anything, we prefer for you to call us before a poison exposure happens so that we can hopefully prevent something like that from happening in the future. We're also hearing about people that are using cleaning products on food. So that could be using it on groceries that they're bringing home from the store or even on takeout. So please do not use cleaning products on food. Right now, there is no evidence that the virus is transmitted through food. And by using things like bleach or disinfectants on stuff that you then ingest, you could be ingesting those chemicals and it could make you quite sick. So instead of using a chemical on your food, just wash your hands when you get home from the store or after you pick up takeout, and just wash produce regularly with water and a brush. There's no need to soak produce in a bleach solution or anything like that. When you are done using cleaning products, it's really important to store them safely. So first and foremost, store them in their original containers. So I have this photo on a slide. I'm not sure if everyone can see it that's on the call right now, but it's a Gatorade bottle, a lemon lime Gatorade bottle, and then a Lysol bottle for a multi-surface cleaner that's the same color as the Gatorade bottle. They're both yellow liquids. So we, again, receive a lot of calls about folks who might have leftover cleaner that they've mixed together or something. And then they just store it in a bottle, like a Gatorade bottle, empty bottle that they have around. When that happens, it can be really easy to mistake the cleaner for something that is actually drinkable. So it's very important to store products in their original containers. And then to label those products with Mr. Yuck stickers or any other form of labeling that is quickly identifiable. So Mr. Yuck stickers might not be accessible for folks right now if you don't already have them. So we encourage you to use tape or marker. You can color caps on things, really anything that is very immediately visible. and then store any of those products up high and out of reach of any young children that might be in your home or visiting your home. And here is our phone number again. So please, we welcome calling for any questions about products, or if you are feeling sick after you've been cleaning, or if you have some sort of exposure to a cleaning product. Do we have any questions about cleaners before I move into medications?
What's the number that?
It's 1-800-222-1222.
1-800.
222.
Go ahead. 222.
1222.
1222. 1-800-222-1222. Okay.
Yep, perfect.
Thank you.
Yeah.
Thank you.
Okay, so we'll talk a little bit about medications now. What we get concerned about with medications is people taking their medications incorrectly or having a medication error. So when I say medication error, I mean essentially taking the wrong dose of a medication, so double dosing, or taking 2 pills instead of 1 pill, something like that. Taking the wrong medicine, so taking Pepto-Bismol instead of Dayquil or something like that. The wrong person, so taking your spouse's medication or even your pet's medication. The wrong time, or the wrong way. So ingesting a medication that's supposed to be rubbed on your skin or something like that. For older adults, we've always been concerned about medication errors. Because, I mean, usually for older adults, there is a lot more medication use happening compared to younger people. And there can also be some age-related challenges, that just natural challenges that arise that might make it more difficult to take medications safely or correctly. So like worsening grip strength or worsening vision, some things like that just naturally occur with age and might pose some challenges. But during this pandemic, we are even more concerned because there's been a removal of a lot of supports for safe medication use. So folks are at home a lot more. They probably have had to change their daily routine a lot. So if someone previously relied on memory cues to take medications, they might not have those anymore. For example, if you always took your pill as you were grabbing your coffee cup to walk out the door, well, you're not going out anymore, so you don't have that cue now to remember to take the medication then. There's also a lot of stress occurring right now for everyone. I mean, there's just constant deluges of information. There's a lot going on potentially with our families. It's just a stressful situation in general with the economy and all the uncertainty. So that can cause a lot of distraction and a loss of focus when taking medications. And then if someone also previously relied on a family member or a friend or some other caregiver to help them take medications, they might not have that same support anymore. They might not be able to see those people as often or at all anymore, and so they might need to be a lot more independent. So we can prevent medication errors from happening by using what's called medication management strategies. And so the first of those is just a general bucket of safely storing medications. So just like with cleaners, you always want to keep medications in containers, preferably their original container or a pill box. Never leave medications loose because then it can be very difficult to tell one person's medication from another if there's a couple people in the house. Or if there are kids in the house, they might not realize that something is a medication. I always tell the story here of my grandmother who kept her medications in a candy bowl right next to the actual candy bowl on the counter. So it's important to make sure that you're safely storing them. And then to keep medications separate from those of other household members and pets, if possible. Sometimes that's not always possible. So if it's not, then you can use some form of labeling again. So that could be, I have a slide here that has these colored bands on pill bottles, and they're different colors. So one person could always have the blue band bottles. Another person could have the yellow band. You could also use different colored pill boxes, or just tape, color, like using a Sharpie to color the caps different colors. There's a lot of different ways that you can add labeling to something. And then just like any harmful substance, store them out of sight and out of reach of any kids. So reading medication labels closely is another management strategy. So first, to follow the instructions, take the recommended dose at the recommended time increments. But what's really important and what we hear about a lot is checking ingredients in over-the-counter medications. Sometimes folks don't realize that active ingredients in medications can be the same across a couple different medications. So acetaminophen is a big one with this. So acetaminophen is Tylenol, but it's also one of the primary ingredients in Dayquil. So someone may not realize when they have a cold, they have a headache with their cold, so they take Tylenol and they take Dayquil. So they end up double dosing that medication, which can be quite harmful if that happens. Physical tracking systems are another great way to make sure medications are being taken and that they're being taken correctly. So there's lots of different ways that you can do this. So we have on our website a medication checklist or a medication calendar that you can freely download. And I'll make sure that Catherine has the link to this for anyone who's interested. So essentially you would just write the medication checkbox for the day and the time that you take it. You can also just use a paper calendar or a cell phone calendar, really whatever works for you. There are even fancy medication apps available, usually for free, that'll give you take things. Pill organizers can serve as those physical tracking systems as well. So those can be pill boxes, or some pharmacies will even provide your medications in bubble packaging, so they'll package them up dose.
So Megan, there was a question from Roger. He asked, I have to rely on a cell phone app for reminders, but I haven't found one that's reliable and easy to use. Do you know of a good Android app?
Ooh, that's a good question. Not off the top of my head, but I can do some digging and look for you. I did have a list of apps at one point that I just can't remember what they're called now, but I'll be sure that I email Catherine an answer to that.
Okay, great, thank you.
I've tried a number of different apps, and many of them are very confusing as to how to use them, and oftentimes they're very unpredictable, so you don't really know whether you're using something that's accurate or not.
Mm-hmm.
I've reached a point of total frustration with these things. A good example is an app called MedList, M-E-D-L-I-S-T, MedList Pro, that looks very well designed, but extremely hard to use. And I've missed a couple of doses because I was relying on that app. So I haven't found any other way to really keep track of pills. Using the containers doesn't work. Shuffling things around so I know whether I've taken them in the morning or the evening. No, because my memory just isn't very good anymore. I have to rely on some other source. So I'm really desperate to find something that works.
Yeah, well, I'll look through some apps and I can put some options together, and I'll be sure that Catherine gets them. You could also try, instead of a cell phone app, if those are just too difficult, there are some pill organizers that that are beyond just like a simple pill box that can offer increased levels of support if your memory around taking medications might need a little bit of assistance. So, for example, there are some that will flash, like a light will flash when it's time to take your medications, or might have like an audio cue of some sort. So those can be good options. Those typically, though, they are more expensive and they're not always covered by insurance. So it can involve working with some, it can involve working with potentially some care organizations to help get that set up. But I can include all of this in my email to Catherine, some ideas for folks, because yeah, this memory piece around taking medications and tracking whether you've taken them, that can be very, very challenging.
It is very challenging. Well, thank you. I appreciate any help you can provide.
Yeah. And I just saw a question about will the PowerPoint be available? And yes, I will make sure that you have the PowerPoint as well. Okay, so I'm going to move on to medication lists. So medication lists are a very important mechanism to make sure that you know exactly what you're taking and how to take it. And it can be especially important if you then end up taking any over-the-counter medications as well, so that you make sure you aren't double dosing or might have some sort of interaction between medications. So at a minimum, a medication list needs to include all of the prescription medications and over-the-counter medications you regularly take, any vitamins and supplements, and any other sort of substance that you may use. So we tell folks, even if you use like a CBD tincture or something, that needs to go on your medication list as well. So again, we have templates and guides for all of this on our website. I'm not going to linger long on this, just so that we can have a bit more discussion, but I'll be sure that you all get all of this information. Expired, unneeded, unwanted medications, when those are kept in the home, it increases people's risk of accidentally taking them. So the Poison Center runs Take Back Your Meds, which is a website that you can go and dispose of those medications at secure locations. But obviously right now during this pandemic, that might not be the best option for people to go out somewhere and dispose of medications. So our recommendations right now are to take them back if you're already going to be at a pharmacy or something like that. Otherwise, safely store any of those medications by keeping them up and away, out of sight, out of reach, and if possible, locking them up. And this is the website. So there are a few locations that you can dispose of medications in Issaquah. Looks like someone might have a question.
Oh, this is Roger. It's not a question, but I've learned from living in Sammamish that I can take old medications, things like that, to the Sammamish, what's it called? It's the same building where the council meets, but there's a big metal
Police
box.
department.
Right. There's a big metal box just inside the foyer where you can drop off old medications. And I think that might be true with other municipalities as well.
Yeah, there's a lot of different places in Washington and in this area, especially in King County, that you can take back medications. That could be pharmacies, it could be police departments. If you go to this website, you can look at a map at all of them, or you can also just look at a list city and it'll tell you the address of where those disposal sites are located. And they're always free. And they're very easily accessible. They're always confidential too. They pick up whatever's in the box and they incinerate them. So it's really the safest way to dispose of medications. And the last slide for medications is to add any labeling to lookalike substances. I have a few examples here on the slide. So if you aren't able to see the slides, so I have some eye drops, nasal spray, some glue, ear drops, and e-cigarette flavor or e-juice. And all of the bottles look very, very similar. So we hear a lot from folks who end up using something incorrectly that they've mistaken. So like they want to use their eye drops, but they end up putting eardrops in their eyes instead, or glue in their eyes instead. And so we call all of these products lookalikes. And so a way to prevent those mistakes from happening is to use stuff like Mr. Yuck stickers or tape, or again, coloring the caps, any of that easily identifiable labeling. And to give us a call at that 1-800-222-1222 phone number if you think you might have made a medication error, or if you're not sure, we can always tell you if it's safe to take your medication, or if you should wait, or just what you should do. Some quick notes about self-medicating. There are a lot of rumors that are circulating right now about different substances and medications and vitamins that might help prevent or treat the virus. But there are no currently approved substances or medications or anything to do that. So it's important to be very wary of these product claims, because using products that claim to do this might have harmful or even life-threatening side effects. They might interact with other medications. There can be a lot of risk in using some of these products. So always talk to your doctor or pharmacist before you try a new medication, vitamin, or supplement. You can also call us at the Poison Center and we can answer your questions about it. Never use disinfectants like bleach or any other non-pharmaceutical substances in ways that they aren't intended. So I know there were some rumors about drinking a small amount of bleach or other disinfectants that would help kill the virus in your body. That is a very unsafe thing to do. So we just recommend call us first or call your doctor first. And I think I'm gonna keep skipping through some of these slides. So
Roger, did you have another question?
Yeah, I do. I've been I take care of my hands and everything. I wash them at every opportunity. But when I come home, I'd like to be able to use a disinfectant around doorknobs and things that I touch frequently. And I've been trying to find a 70% isopropyl alcohol solution, which I'm guessing might be the best option for a disinfectant, but I can't find it anywhere. What could you use as an additional disinfectant besides soap and water that might be easy to find somewhere?
That's a good question. I'm not sure what I could recommend. I think you could. So I don't know. I'm not aware of what's really available in stores right now, so I can't answer that part. You could call the Poison Center, and they might be able to tell you what effective things are. Yeah, I don't have a very good answer for you on that one.
This is Maddie. Can you use bleach and water? And how much bleach would you put in the water if you can?
I think that really depends a lot on how you're using it. So, and that also depends on the product.
I meant for the disinfectant on the doorknobs.
I suppose you probably could, but you would just need to be sure that you follow any directions on that product label really closely.
But you don't know how much?
No, because it's going to depend on the product a lot.
I've been told.
Can you use Lysol? Can you use Lysol?
To disinfect, I would imagine so. Again, I can't really answer any questions about what specifically will kill the virus. So
No, I mean, but as a, as a disinfectant, is that safe to use, Lysol?
if you're using it as it's supposed to be intended, then yes, that would be safe to use.
Okay.
Yeah.
Okay.
I just thought maybe Roger could use water and bleach, but you don't know what to put in, so.
I read somewhere that I think a tablespoon of bleach to a gallon of water is
Well,
what's
can you
Somebody
find
told me-
Lysol
It's hard to find
Lysol
that.
someplace?
It's
Oh,
hard
it
to
is?
find.
I haven't.
Let me tell them the combination that they gave me. 1/3 of a cup to a quart of water. Did you get that, Roger?
Yeah, I did. That sounds pretty concentrated to me.
Okay,
Compared
so
to
don't
what I
use it.
read, compared to what I read. I think something.
Again,
Okay.
I think every product is going to differ, so just look at what the label says on your specific product.
Yeah, that's probably the best thing to do.
It's so hard to find
Have
the
you looked-
products right now because people are hoarding it.
Really?
Impossible.
Oh,
Yeah.
Really impossible.
oh, unbelievable. I don't know. I ordered it and had no problem here in Bellevue.
I've tried calling some pharmaceutical companies and chemical companies and who supply things like 70% isopropyl alcohol, and they say that nothing is going to be available until probably mid-June because they're supplying,
Wow.
they're sending all their stock
Wow.
to medical facilities.
Well,
Roger,
when
can
in
you
doubt-
get to Target? Husband finds a lot of stuff at Target whenever he goes.
Yeah. That's
Try
good.
Target in Issaquah.
Oh, thank you. Yeah, I will.
And when in doubt, just washing your hands a lot works great. So I understand how difficult it is
Yeah,
to
that,
find products.
That's something we're doing every minute of the day. As soon as we
Yeah.
touch
But
something.
he wants to know about the
We're
doorknobs.
washing.
That's what I'm trying to tell him.
I can't avoid a little
Yeah.
humor here, but I like to wash my hands of the whole situation.
Right. That was good, Roger.
All right, last couple of things. So I have some specific recommendations for any of you who are grandparents, because I know that some grandparents are helping take care of kiddos right now since everything is so thrown off with school and parents' work. So we have some specific recommendations, and the first is with hand sanitizer. So hand sanitizer has a very, very high alcohol content in it. It has to in order to work. It's usually around 60% alcohol, and that is a lot stronger than wine, than beer, than really most hard liquors. So when kids are using hand sanitizer, if they ever ingest it, so if they were to actually drink from the bottle or if they were to lick their hands after it's been applied, it can actually put them at risk of alcohol poisoning. And we took a look at the calls we were receiving about hand sanitizer, and we have seen double the number of calls right now about hand sanitizer, mostly kids. So it's definitely a concern. So just if you have kids around, be sure that you always supervise them when they're using hand sanitizer. Just use a small amount, like a dime-sized amount, and have them rub their hands together until they're completely dry, and then keep those bottles out of sight and out of reach when they're not in use. If a kid does lick their hands, or if they do drink some of that hand sanitizer, be sure to call us immediately. Don't wait for any symptoms. Just call us right away, and we can walk you through everything you need to do. And if you take medications and you have kids around, be sure you take them out of sight of children. So kids love to model the adults that are in their lives. So you wouldn't want them to then want to take medication just like their grandmother or grandfather and end up mimicking you and take a medication. Always check the carpet or floors for any dropped meds. I have this slide here that has medications next to candy, and they look almost exactly the same. So when they're on the floor, you can't tell what's what. So it's really easy for kids to think something's an M&M or a Skittle and pop it in their mouths.
It could be dangerous for pets too.
Yes, yeah, definitely. Okay, quickly, so we have a little bit of time for discussion. I'll just walk you through what to expect when you call us. So first, why call us? We've gone through that a lot today. Call us if you have any questions or emergencies with potential poisons. You don't have to have had an exposure to call us. Call us whenever you're in doubt or whenever you aren't sure about something. And you can call about yourself or you can call about other people. It doesn't matter. We'll help you regardless. We're still open during this pandemic. We're still open 24/7 every day of the year. Our hours have not changed at all. So when you call us, you're going to talk to what's called a SPI, or a specialist in poison information. These are nurses or pharmacists, and they have all gone through very extensive training on poisons and toxicology. If they ever need any additional assistance, we also always have on-call board-certified medical toxicologists. So these are physicians who are also specially trained. There's only 7 of them here in the state of Washington. They all work for us. And so they can help provide a little bit more direction in some of the more complex cases. So when you talk to the SPI, they're going to guide you through a series of questions. What was taken? How long ago did it happen? How much was taken? How are you, or how is that other person feeling? It is totally fine if you don't know all of this information. They're just going to try and gather as much as you know. And then they will tell you what to do. They'll either tell you that you can stay home, and they'll tell you exactly what to do at home and what to watch for at home. Most of the time, this is what's going to be what happens. I think it's about 93% of the time we can keep people at home. But sometimes you have to go to the emergency room. They will tell you that. And they will also tell you if you can drive yourself or if you need to call 911 and get an ambulance. And then usually we're going to call you back after a while, just to make sure everything's all right. And you can ask us more questions then, or you can call back later if you have any other concerns. And one more time, our phone number is 1-800-222-1222. So please call. We are happy to help with anything. And I have my email address and phone number on these slides, which I'll be sure that all of you get the slides. I'll put together some of those resources I talked about, and I'll make sure Catherine has them all and can distribute them to you. But otherwise, we can dive into any other questions that you have.
Well, this is a little unrelated, but I think I fractured my right index finger. I did it about 3 years ago. I think I did it again yesterday. I can tell there's something wrong with it. All the advice is just don't call your doctor about things, little things like that. But I don't know what to do. I don't know whether this is worth calling the doc or not.
Is there a nurse line you can call, Roger?
I don't know of one.
Because I know with
your doctor. Your physician. Does your physician have a line to call?
Well, I might. Yes, I think my VA doctor does have a secure messaging thing, so I'll try.
Yeah, just call the doctor's office and say, "Can I talk to the nurse?"
Yeah. I'm looking forward to hearing from you about any applications you may be aware of for the Android platform for medications.
Yeah, I've been meaning to look more into them. I had a list about probably a year ago, but apps changed so much.
So, they do. There's so many of them, and it's just astounding.
Yeah.
And I'm almost desperate because my memory is shot. I can't rely on it to remember whether I put pills in a pill box or or any, I've got to have some outside source that's programmed to let me know. Otherwise, I can't be sure I'll be taking the meds when I need to take them.
Yeah.
And I'm taking one med that's very important right now. It's an anticoagulant to prevent blood clots, and that's probably my biggest biggest thing I'm worried about.
Yeah.
This is Maddie. Can he make a list with the times that he's supposed to take the pills? Write a list and the times? I don't know.
I think that'd be really similar to probably the medication checklist that we have. Roger, did you see that when I had it up on the slide?
Yeah.
It's just a paper checklist. That might be an easier option.
It's just that, my memory is, from 1 minute to the next, I could write something down and then forget that I did it. It's just totally unreliable. I really need an outside source to say, hey, wake up.
Do you have any family that can help you?
Oh,
That can call you? You have anything?
that's an interesting thought. Yeah, I hadn't thought about that. Yeah, thank you.
Yeah, have your family call you and remind you. Give them the list and they can do that.
That's a good idea.
Lots of
You
people
could also-
home now.
Yeah. You could also just set daily alarms on your phone. Instead of using an actual app.
I'll have to see what
Or if you get Alexa could remind you.
There you go.
My two kids wanted me to have one of those.
What's Alexa? I haven't heard of it.
Oh, she talks to you. Tell your kids about it.
Yeah.
She'll talk. Alexa talks to you, so maybe they can put it in Alexa.
You see, that's it. I don't have any kids, so I'm
Oh.
Otherwise, I'd rely on them to help me with everything. I'm sure.
Oh, you don't
Right,
have kids.
absolutely.